Today, we're talking all about chronic constipation. And if you've tried the diet, feel like you've tried everything and you just can't have a good poop and you're straining for dear life and you're like, what gives? You've seen all the registered dietitians, you've seen all the nutritionists, and you're still having an issue and they can't figure it out. You might potentially be having something going on with your pelvic floor that is preventing you from having a decent bowel movement. So we are going to look at how the pelvic floor plays an active role in something like chronic constipation. And I'm going to give you some tips that you can try and see if those help. Now, I'm going to preface this, like always, by saying that this is for educational and informational purposes only. If this is something that you're going through, your best bet is to consult a pelvic floor physical therapist, because we can absolutely help you overcome issues that might be leading to this chronic constipation and help you get over them. A lot of people don't even realize that that is something that we do have in our wheelhouse and something that we help treat very, very frequently. So that's gotten out of the way. Let's talk a little bit of anatomy. This way you can see what's going on. So I'm going to bring my pelvis out here today. And this is a female pelvis. Guys, I'm sorry. Your pelvic floor acts similarly. Obviously, you don't have a vaginal opening and you don't have a uterus, and you never did. But this is the area in which I'm trained. So if you have a penis, by all means, you can stick around, because all of these tips actually will also apply to you. But when I talk about the anatomy, we're talking about the female anatomy today. So underside, let's take a look. This is the vaginal opening. This is your urethra. This is where pee comes out. And then down here, we have the anus, which is where the poop comes out. And then if we tip forward, these are all the organs that are in a female pelvis and are all affected by the pelvic floor and vice versa. So from the back, we have the rectum. That's where your poop comes out. I call it the poop pipe to simplify things. So that's what we got here. We have the uterus here, and then we have the bladder here. So look at this orientation here. If your rectum is full of fecal matter and is not really having the best time coming out, and your rectum is full all the time, you can see how closely related it is to the uterus and then in turn the bladder. So what happens is it's putting pressure, or potentially putting pressure, on those structures. So in addition to not being able to poop, you might actually be leaking pee as well. Excuse me. Because your pelvic floor is counteracting that pressure on the bladder, and you could potentially have a weak and a tight pelvic floor, which is also giving you this urgency symptom, meaning you feel like you have to rush to the bathroom, otherwise you're going to pee your pants, or you feel like you have to pee all the time and you're like, what the hell is it? Because you're cleared of infections, you're cleared of STIs, you're clear of bladder infections, and nobody can figure it out. You could potentially, in that case, have a tight pelvic floor, and this pelvic floor does not know how to relax. It's like gripping for dear life around things like your bladder and just giving you that, oh my God, I need to go to the bathroom right now sensation, even though when you go, a couple drips might come out and you might not really feel like it was an eventful thing. You know what I mean? So those are all potential problems that could happen with a tight pelvic floor, in addition to this chronic constipation. So I'm going to remove the bladder and the uterus, and we're going to look at the rectum. And I apologize in advance because my organs tend to fall all over the place. So if that happens, just bear with me here. So see? So there's the rectum sitting back there, and all this pink stuff around the rectum is musculature. So these are the muscles that live inside of your pelvic floor. Where is that pipe coming down to reach the anus? Through musculature, right? So if this is all tight and it's having a very difficult time relaxing and going through that full excursion, when I say excursion, I mean we want our muscles to be able to relax and be flexible, and then we want them to be able to be contracted, or not be contracted. We want them to be able to contract through that full range of motion and be strong and have great endurance. This is where things like a healthy pelvic floor comes into play, having that nice balance of flexibility and strength. And if your pelvic floor is tight, you might be lacking that flexibility, and you could also potentially be lacking that strength here. So especially with chronic constipation. So this musculature is surrounding the rectum, meaning that the poop is just like it's stuck, it's bottlenecked pretty much, and there's nowhere for it to go. So we really need to learn how to relax those muscles and figure out what you potentially could be doing throughout the day that's causing that tightness, that's causing that compensation, that's causing that gripping. Like this is something that would be really, really beneficial for you to work one-on-one with a PT, a pelvic floor PT like myself, to get to the root of that and kind of mitigate it and allow yourself some relaxation. Okay. So let's get into some tips. So that's like the tried and true gold standard. Make sure you're getting one-on-one treatment and really recognizing daily patterns that might be contributing to that. So that being said, here are some tips that you could potentially try that you might not have thought about before. The first one, we want to make sure we are properly hydrated and we are properly fed. Hydrated, textbook, technically is half of your body weight in pounds in ounces, if that makes sense. So, for example, if you're 200 pounds, you're going to drink 100 ounces of water. Okay. This is not given what you're doing outside of just laying there. So, if you're exercising, you're probably going to want to hydrate a little bit more. If you're sweating, you're going to want to hydrate more, like things like that. But typical rule of thumb, you're probably not drinking enough water. Most people are not. All of my clients will fall into that category, but make sure that you are properly hydrated. The other side of the coin is you want to make sure you're taking in a good amount of soluble and insoluble fiber. Soluble fiber sources help you absorb nutrients from your food. And this could be things like beans and legumes. Those are oats, I think. I don't know. I'm just throwing stuff out off the top of my head. But those are typically soluble fiber. So we want to be able to absorb the nutrients, but we also want our fecal matter, our poop, to be able to pass through us. And that's where insoluble fiber comes in, which is things like vegetables, fruits, and all that good stuff. So we want a good mix of insoluble and soluble fiber and water to move things along. The next thing we're going to talk about is something called a bowel massage. Now, you can do this in any position that's comfortable. Probably, I'm trying to think which would be beneficial. Maybe lying down at first to get acclimated to doing this and then sitting up, but everybody's different. You can do whatever you want. I'm going to show you standing up. I'll show you sitting down. This way you can see. I'm just going to tilt this down here. So a bowel massage, you're going to find your hip bones. So mine are right here, and you're going to work from, I'm going to actually show you a mirror effect. So I'm starting on my left side, but you're going to be starting on your right side. Starting in the right lower quadrant, you're going to move up. So you can do strokes if you want, long strokes. You can do circles if you want, coming from the right quadrant upward. Then you're going to move across. This is your transverse colon coming across. Same thing. You could sweep. You could do circles. And then when you get to the left side, whoop, you're going to come down. Same way. And then just really following that colon. So it's ascending, it's transverse, meaning cross, and then descending colon. So you could do this a couple of times a day if you want. Just don't really like go digging in there. It's a gentle massage, stroking or circles. Sorry. And that's another thing that you can do to help get things moving along in there. The other thing we're going to do is practice, or I'm going to show you what to do when you're actually going to the bathroom. So the first thing you're going to do, you're going to invest in something called a squatty potty, or you can use yoga blocks. That's what I'm going to use today. You can use books if you want. You can empty your garbage can in the bathroom and turn it on its side. What we're looking for here, I'll show you here. You want your feet resting on something, and you want your knees above your hips. This helps relax the pelvic floor. So if you're used to pooping and your feet are like this, pointed and they're dangling and they're just kind of like hanging there, you could potentially be increasing tension in the pelvic floor. So we want as much relaxation as we can get. You can also lean forward if that helps open things up back there. While you're going, you can tilt your pelvis back and forth. You can move it side to side. All of that will help with motility or being able to let yourself go, literally, like the song says. The other thing you're going to pay attention to is your technique when you're pushing. So I always say, like, you're not holding your breath, you're not turning purple, you're not going to have the veins in your face explode with this. You actually want to be able to relax and have a nice, I want to say comfortable bowel movement, but let's be real, not all bowel movements are comfortable, but you should not be straining here. So what you want to do is you're going to, when I say let your pelvic floor relax, you're thinking about, you're not pushing as if you're having a bowel movement. You are literally relaxing. So you're thinking about that anus slightly opening. It's not like, you know what I mean? It's like blooming, I guess you can say, like flower blooming, or sometimes they say like blowing bubbles with a straw. So like you don't want your cup to overflow, but you want some air to let that relax. So you should feel that. If this is something you're not used to, it might be difficult. So again, if you're just not getting it, seeing a pelvic floor physical therapist is going to be super, super beneficial to you and super critical for you. So that being said, you want to try to, while you're pushing or while you're sitting here, I should say, you're going to inhale, fill your belly up with air, let your ribs expand, and allow your pelvic floor to relax. And then on the exhale, you're going to push to have your bowel movement. Again, we are not pushing for dear life. We're not straining here. We're not turning all colors of the rainbow. It's gentle push. And then you're going to just keep repeating that. So inhale, fill the belly up with air, expand your ribs, relax the pelvic floor. Exhale and push. Okay? That's exactly how you are going to try to have your bowel movement. So I hope you found some of those tips helpful. Now, I do want to also add that if you are experiencing chronic constipation, working with a registered dietitian and a pelvic floor physical therapist are probably your two best bets for overcoming this, because I do believe that there is a dietary component as well as a physical component, muscle performance wise. So more and more of us are working virtually. So if you are in an area that doesn't have the best access to pelvic floor therapy, a lot of us do work virtually, myself included. You can always feel free to reach out. I will leave my contact information below. And I'm also going to put 2 resources for finding a pelvic floor physical therapist near you. Both are directories. So you just throw in your location and it'll pop out with some PTs available who are specifically trained in pelvic floor that can potentially assist you. Please, I'm going to jump on this soapbox again. Make sure that if you are having issues with your pelvic floor, that you are seeing a specially trained pelvic floor physical therapist. Pelvic floor is the new buzz term in the rehab world. Everybody pretends like they know how to do it and can help with it. And not all of us do this. This is not something we get in PT school. It's not something we get in grad school. We actually have to go for additional training after graduate school in order to be able to assess and to help you. So by all means, when you're interviewing your healthcare provider, especially a pelvic floor physical therapist, you want to make sure that they are trained in internal assessment. Even if you decide to waive this piece of the exam, and I mean, if you're working virtually, you're not going to have it anyway, but even if that's not a part of your plan of care, you want to make sure your provider is trained in internal assessment. By all means, you can absolutely ask, and I encourage you to ask. And then you also want to know with whom they have trained. So the two top heavy hitters, the APTA and Herman and Wallace, those are like the biggest ones. So make sure whoever you're seeing, again, even if you're waiving or you do not qualify for the internal piece, you want to make sure that they have some background in that, because me personally, like when I'm treating somebody virtually, I am not physically going inside of them to assess internally, but I do know what they should be feeling. I do know what should be going on, even without having my hands on that person or in that person. So your person should be able to do that as well. If you have any questions, my inbox is always open. Please drop me a line. Also, let me know if this video helped you, and good luck on your pelvic health journey, and I'll see you next time.